Hey guys, another fun practice questions video. This one is going to be all about diabetes. So the purpose of these videos are to help you to start to better understand, what to expect from, a lot of our exams, like what kind of questions we're going to ask, because especially there seems to be like a drop off from foundations into the adult course, into the kind of questions you're seeing, because we're jumping into a lot of application. But I think it also helps because a lot of students, they'll study the information, they'll memorize it, but they don't know how to put it into a situation or a scenario. So at the end of the day, they're unable to, to be successful. I've had students that, memorize the entire textbook, but they cannot seem to get through a lot of these questions. So that's why it's so helpful after studying to start bringing stuff together through questions and putting things into scenarios and application. So hopefully these questions will help you. If I can get the slideshow to move forward. So here's the first question. It says a client has received 3 units of insulin Lispro an hour ago. What assessment finding is most concerning to the nurse? So I was also going to mention part of it's about like learning the material, but I also want you to learn some test taking strategies. So some strategy here are to kind of break down this question. This question is asking you to, one, understand what insulin Lispro is, like how fast it's going to work, and then also to know, what you're going to need to do. So what are the side effects of it? Because really what this question's asking, because it says what assessment finding is most concerning. So this is saying like what after receiving insulin Lispro would be most concerning to me. And so that doesn't even mean, this could mean that some of these are concerning, but are not as concerning as others. So which one is most concerning? First is that the client states they have a mild headache. And so already in that answer choice, my first thought is it's a mild headache. Okay, like I don't like headaches, but headaches can be a sign of blood sugar issues, but a mild headache, it doesn't sound like life or death concerning. The next one is the client had urine output of 550 mils this shift. So for this, I would have to know, well, what's normal? I don't know, that sounds maybe a little high, maybe normal, I'm not sure. I'm going to kind of keep that one in my back pocket and see if I want to go back to it. The client state they have tingling in their left foot. Well, this sounds like something a patient with diabetes might have as a result of, having diabetes, that they can have those neuropathies or the diabetic sensory neuropathy. Now, a lot of students would want to choose C because they're like, oh, that's not good. I need to let the doctor know they have the sensory neuropathy. And definitely probably do want to let them know especially if it's new or different. But is this a life or death? Like really this is saying like which of these, if you don't report it, could lead to the highest chance of death, consequences, etc. And specifically also it's asking about in relation to the insulin Lispro. So the fact that it's telling you that, hey, the client received 3 units of insulin and now what assessment finding is concerning, it's not just saying, hey, for a client with diabetes, what assessment finding is concerning. It's saying, hey, they received insulin. So which assessment finding after receiving insulin is most concerning? So you have to always keep that in mind. You have to, there's sometimes that they put data in questions to throw you off, but this is one where it's really key to notice. It's really saying what are the side effects of insulin Lispro, or what would be a sign of a problem from this? The last one is the client is tired and has a heart rate of 115 beats per minute. Now, that kind of sounds a little concerning compared to a mild headache, maybe some like increased urine output, which might happen with diabetes anyway. I'd be much more, and in the tingling in the left foot, again, maybe that's a result of their diabetes, but it's not really related to receiving insulin. But if they're tired and have a heart rate of 115, that sounds a lot like hypoglycemia, which would be a sign of not an adverse effect, but that they may have gotten too much medicine, or maybe they didn't eat enough after getting their Lispro, because Lispro is a rapid acting insulin. So if they don't eat immediately afterward, they can have serious problems. So the fact that they're tired, getting that decreased level of consciousness to have an increased heart rate, to me, that's kind of like ding, 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 the patient might be hypoglycemic. So let's say that you're also just super smart and you kind of notice that that's another, you can always start in the question and you say, hey, a patient received Lispro. Okay, if they received insulin, what am I most concerned about? Well, if they received a medicine to lower their blood sugar, I'm going to be worried their blood sugar got too low. So then you could read these questions and say, which one of them is a sign that their blood sugar went too low? But, it's also fine to go through and do this. When you're doing practice questions like this, it's really helpful to look at the answer choices and not just just look at, whether they're right or wrong, but what would they be a correct answer for? When would this be a problem? Is this okay? Is this related to something else I need to know? Because it kind of helps you to study for multiple things at once. But the correct answer here is D. That's a sign of hypoglycemia after receiving insulin, because this is during, it's starting to get into the peak time for the Lispro. And so I will need to keep a close eye on that patient for the signs of hypoglycemia. This one says, a nurse is providing discharge education for a client with type 2 diabetes related to foot care. What should be included in their teaching? Select all that apply. Ooh, your favorite. So with select all that applies, I always start at the top and make my way down. Most of the time, these are going to be knowledge questions. There are some that can be more higher level questions, but most of the time we're just looking at knowledge, like, is this true or is this false? So you go straight down, don't play any games, don't try to figure out, okay, should there be more of this, oh, I chose 3, should there more than 3? Or, oh, I only chose 2, shouldn't there be at least 3? Like, don't be playing those games. Just going straight down, true or false. So going back to the question before I get started, because a lot of times what happens when you read a select all that applies, you read it, you read the question, you're like, select all that apply, and the doom sits in and you're like, oh my God, I'm going to die. So like, I'm not making fun of y'all, because trust me, I was a nursing student not that long ago. I remember the fear. And so at the end of the day, I usually have to go back and once I see that select all that apply, it's like doom sets in. And so I have to go back and remember what the question's asking. So I'm doing discharge education. This patient's going home, they have type 2, and I need to teach them about foot care. So let's see what I should include. So should I teach them to clean the wounds on their feet with alcohol to prevent infection? Well, I know infection is an issue for diabetes, but I don't think we want to use anything that's like super caustic or super hard on the skin. So I'm going to say false. Now see where I made that decision in my head, that's false, move on. Ensure socks have a tight fit to prevent rubbing against skin. Well, I definitely don't rubbing on the skin, but I don't like the word tight fit. Definitely in a question like this, and select all that apply. And then in any question, you should always look for those keywords that are extremes. Like we usually we don't like things too tight, too loose, too high, too low, like, that stuff that we're usually not like most things we're not like. Most of the time a correct answer is not going to be every time, always, never, like not always, like, and don't quote me on this. Don't come back and be like, hey, Miss Woodruff, you said that those are not usually, or they're not the correct answer. Sometimes they are, but we don't live in a world of extremes in nursing. There's a lot of gray. And so just keep in mind that usually those extreme words, like, they have to eat 100% of their meals, or, et cetera, et cetera. Like, I mean, just those kind of extreme statements, usually they're not the correct answer. So this tight fit, I don't like that. That tight fit, I feel like that's going to be not good for their skin. So I'm going to say false, and I'm moving on. You should check all surfaces of your feet daily. That sounds pretty general, pretty good, and I like it. So something else to keep in mind, as much as, we don't want to be too much on those extremes, like, oh, it has to be this or has to be that, etc. Like those extremes, like we don't, like I said, like it's usually not always every time, etc. Sometimes general answers can also be a problem, like where it's so general that it's not specific enough to what the question's asking, but this is specific to the question. It's saying, what am I going to do for foot care? I'm going to check all surfaces of my feet. I like that. So I'm going to go with C being one of my correct answers. Apply lotion to your feet daily, except between your toes. So yeah, so if I know anything about foot care, I do know that the feet can get dry. So applying lotion sounds good. And it says, except between your toes. And I have to think back, well, why would I not want it between my toes? And, if I, had my lecture with Ms. Woodruff, I might have heard her say that, that there's a lot of moisture that can happen between the toes. And so I don't like to put the lotion between the toes because it can lead to like fungal infections. So I'm going to say yes for D. So far I have C and D. And then the last one, decrease fluid intake to prevent swelling of your feet. Well, with type 2 diabetes, I don't know about decreasing fluid intake. That doesn't sound good. Usually I want them to not necessarily increase their fluid intake, but they need to have good fluid intake to stay hydrated, because they can lose some fluid because that excess sugar pulling fluid from their cells, etc. So I'm going to say no to that one. So I only have 2. Now I'm not going to go back and play the game. Well, I only have 2. Let me reread the answers, relook at the question. I am settling with my C and D, which are the 2 correct answers here. So keep in mind with our select all that applies, On the NCLEX, I think it can be one or all, but on ours, we usually have at least two, and it can be all. So for ours, we never have it as just being one as the correct answer, but we have at least two, and it's possible for it to be all of them, but usually it's not. So question 3, a nurse is admitting a client with type 1 diabetes who's in diabetic ketoacidosis. Which order is priority for the nurse to complete? So these are the hard ones, answering a priority question. This is saying, what do you need to do first? So when you look at a question like this, you want to think about, okay, what if I don't do will lead to the biggest complication? Or you could also look at what action, if I take, will have the most direct or most helpful effect. So they're in a state of diabetic ketoacidosis. So I just have to know, what's the problem here? Well, I'm dehydrated and I have too much sugar. So let's see what's going to help me with that. So if I already kind of have that in my head, I can start framing that. But something to keep in mind is that a lot of times you read a question like on a nursing school exam, and you have in your head, oh, I know what the answer is. But then you go through the answer choices and you're like, wait, my answer isn't there. And I've seen students time and time again not select the right answer because they're just like, oh, well, there's like, yes, I knew that answer could be correct, but it wasn't the best answer that I wanted. And so sometimes even if it's not the best answer, if it's true, it can still be the right answer. So we'll talk about that, and I'm sure at some other time. So administer sodium bicarb. And by the way, also this is saying what order is priority, which means I'm probably going to complete all these orders, but I'm figuring out what I need to do first, or what's most important, or what's most directly helpful. So administering sodium bicarbonate. And so this, I think that this is something I might do for DKA, but it doesn't seem like the first thing. They are in a state of acidosis, but the administering sodium bicarb will not decrease their blood glucose, and it will not rehydrate them. So I don't think that that's going to be my priority. So the next one is administer D5-half-NS at 100 mils per hour. Okay, so fluids, that sounds good, but it has D in it, which means dextrose. And if I have a patient who's in diabetic ketoacidosis, they have a ton of sugar in their blood. I think I'm going to give them the D5-half-NS, but not till their blood sugar is lower. So this is not going to help decrease their blood glucose. So I don't think that I want to do that. So then I'm on to C, which says administer insulin regular infusion. This was the first one that sounds okay because it does help me to get my glucose back into my cell, which is going to help to lower my blood glucose, which is one of my major priority goals. So I'm going to keep this one on the back burner. Let's see the last choice. Administer oxygen at 2 liters nasal cannula. Now, when I'm someone who's been in nursing school and I've seen a lot of questions, the hard thing is anytime I see something respiratory related, like listen to lungs or, apply oxygen. And so it's really hard not to choose that because I always remember ABCs, like airway has to come first, but I have to remember in this question with diabetic ketoacidosis, is this a respiratory problem? Are they having an oxygenation issue? And it's possible they could be, but when we have these questions, we're talking about the textbook picture of a patient in diabetic ketoacidosis. And this patient, again, my two big things, they're dehydrated, their blood sugar is too high. So giving oxygen is not going to help to relieve their dehydration. It's not going to decrease their blood glucose. So the best answer here for the priority intervention is going to be C, administer insulin regular infusion. Oh, this one's got a lot of data in it. So as we're moving towards the next generation NCLEX, you're going to see more questions like this that are more chart-like questions where they have effectively, data that you have to kind of break down and figure out. So for this one, it's saying, based on the data provided, what is the most appropriate action by the nurse? And then I have an order, and this is a sliding scale. And there's a good possibility if you are taking the class at my college that, and you are in in my class or whatever, that you're going to see a sliding scale question, because we do like to ask these questions because it's important that we know that you understand how to interpret a sliding scale. So I have all the sliding scale. These are my orders. And then I have assessment data. My blood glucose is 175. So in order to, it's saying what's most appropriate action. So first I need to figure out what do I need to do based on my sliding scale. So if my blood sugar is 175, then I look up on my sliding scale, where does 175 fit in here? Well, it fits right here. So I need to give 2 units. So already I can go down here and I can cross out any ones that do not have to do with 2 units. So I'm not going to administer 4 units of insulin and notify a provider. I'm not going to administer 3 units of insulin and encourage their fluid intake. And the tricky thing is a lot of times people, they, what do you call it? And you can go and read all the answer choices and then go back and figure figure out the data. But I think sometimes when you see the information, it can start to skew what you're thinking about what do you call it, what the correct answer is, because you start seeing this is a lot of information down here in these answer choices, especially because a lot of it, part of it sounds really good. Like, hey, notify the provider. That sounds good. Encourage increased fluid intake. That sounds good. But keep in mind with answer choices like this, they're telling you administer something and do something else. There's two parts to that answer. And keep in mind, both parts have to be correct. So even if I want to encourage increased fluid intake, that sounds good. Is the first part of the answer right? And I've had students that have told me, they're like, listen, like, you know, I chose this answer because one part of it was so right and it had to be true that I chose it. And that's what's so painful. Sometimes I'm like, no, you know, the whole answer has to be right for it to be correct. But I understand where that happens. So let's break this down. So I said it has to be 2 units because my blood glucose is 175 and here I am, it's 2 units. So I'm either B or D. So do I either, I guess that my answer choice got cut off, but this is supposed to say administer 2 units of insulin. So apologize for that. So just act like that says 2 units of insulin. So B says give client 15 grams fast-acting carbohydrate and administer 2 units of insulin. So I don't know why I would give them 15 grams of a fast-acting carb and administer the insulin. We usually only do the 15 grams fast-acting carbohydrate when they're hypoglycemic, and there's no hypoglycemia going on here that I can see. But I like the administer 2 units. So this one should say administer 2 units of insulin, and I'm going to fix it just in case people are watching this and what do you call it? Not listening to me at the same time, because I can be very super annoying. So I'm going to change it because that's what it's supposed to be. And it's kind of giving away the correct answer, but hopefully you're still here with me. So then D says administer 2 units of insulin and ensure client has food within 15 minutes. Okay, well, that sounds more right, because then I also need to look, what kind of insulin do I have up here? Aspart. And that's that rapid acting insulin that they need to be fed usually within 15 minutes, because that's when the onset happens. So out of all of these, based on the answer choices, which one is most appropriate is going to be D, because I want to give them their insulin and then make sure they eat within 15 minutes. The 15 grams of fast-acting carbohydrates is probably going to overcompensate. We usually only do those fast-acting carbohydrates when they have a low blood glucose. Hopefully that makes sense. All right, question 5. A nurse is reviewing laboratory results for a client with diabetes. What does the nurse understand about the following results? So hemoglobin A1C, 8.9%. So then I'm going to, like, sometimes I have to read a question 2 or 3 times, and that's okay to go back because sometimes you're kind of processing it. A lot of times people will read the question and then read all of the answer choices, and I feel like you're going to get so like overwhelmed. So I try to read the question at least once, sometimes twice, depending on if there's a lot of data. And I really try to like reword it in my own words. What is it really trying to ask me? So this one says that a nurse is reviewing lab results for client with diabetes. What do they understand? So pretty much I need to know, what does a result of a hemoglobin A1C 8.9% mean? So I would have to know what's normal, and also not just what's normal for a patient with diabetes. And if I did know anything about hemoglobin A1C, I would know that this is elevated. So let's say I'm looking at this problem though, and I don't know. Here's a test taking strategy. So let's look at this problem and I don't know. So there's 2 answers that are opposite. Remember, was it in this video? I want to say it was in my acid-base video that I was talking about when there's 2 answers that are opposite, a lot of times one of them is correct. So the one is saying that, hey, it's shown that their blood glucose has been higher. One saying the blood glucose has been lower over the past few months. So a lot of times that's your cue. So let's say you don't know a hemoglobin A1C. Then I would just have to take a guess between these 2. I got a 50-50 chance if I wasn't sure. Because a lot of times when there's 2 answer choices that, again, are opposite, one of them is correct. But let's look at some of my answer choices here. It says these results are expected for a client with diabetes, so no action needs to be taken. So this is saying, hey, what if this is normal? I said that B is saying like, hey, this is showing that their blood glucose has been higher overall for the past few months. The other one saying it's been lower overall. And then D says this is not the most accurate test. The nurse should check a bedside blood glucose. And so really at the end of the day, I have to know a couple things about hemoglobin A1C. Is it an accurate test? And then I have to know, is this high, low, or normal? And so if I did have that knowledge, I would know that a hemoglobin A1C of 8.9 is elevated for a patient with diabetes, and it is showing that the client's blood glucose has been higher overall. So the hemoglobin A1C, as a reminder, this is a measure of the percentage of hemoglobin that are saturated with glucose. And what happens is when you have diabetes, you have excess glucose in your blood, and it eventually your body's like, well, I need to find some other place to put it when there's so much. And so where it goes is it ends up getting on top of your hemoglobin. So normally your hemoglobin should not have a lot of glucose saturated to it. Usually the normal is like around like 5 to 6% of your hemoglobin should be saturated. When you start getting up, into the, 6, 7s, 8s and above, we're talking diabetes and poor glucose management. Or sometimes they're not managing their diabetes well. So hemoglobin A1C is a very accurate test because the thing here is red blood cells, they cycle through every 90 days, you get new red blood cells. And so if my hemoglobin A1C is elevated, this is not a test that patients can cheat as easily. They would have to have had a very good diet medical management for 2 to 3 months versus having, good management just for, a couple weeks. Sometimes you go into the doctor and you're like, oh, I'm going to the doctor soon. I need to make sure I eat well for like a week or lose a couple pounds, etc. This is not a test that you can do that with unless you can do that, sustain that for months. And so overall, like D is not correct because this is a more accurate test because it's going to tell how their blood glucose is doing over time versus right now. Because my blood glucose could be okay right now, but I could have a hemoglobin A1C of 13. So maybe I'm okay. Maybe I did well today and my blood glucose is stable. Maybe I just took my medicine. But if I didn't, but how am I doing overall? So hemoglobin A1C tells us over time and overall how well is my body doing managing my excess glucose. And then it's not expected for a client with diabetes where there's no action that needs to be taken. I definitely want to let the doctor know because maybe the patient, it may be just that they have new diabetes. Maybe they've been sick a lot lately. There's been something else going on. Maybe their medication is not effective. Don't always just assume because someone has a high one that they're not taking their medicines. Because a lot of people they'll swear up and down, like I'm taking my medicine, and their blood glucose or their hemoglobin A1C is still high. So sometimes they're being honest and their medicine regimen needs to be changed. But other times, or many times they're not really being honest because they're saying they're keeping up with things, but they're really not. So overall, anyway, to get back to it, the correct answer here is B, and you can either use that test taking strategy where you're like, hey, B and C are opposite. One of them has to be correct, or you can look through and kind of, if you know about hemoglobin A1C, figure out what is the best answer here. So number 6, a nurse is caring for a client in diabetic ketoacidosis. Which arterial blood gas result would be most consistent with this diagnosis? So this is the kind of question you guys love to hate, that it has a mix of diabetes and acid base. So if I know anything about diabetic ketoacidosis or acid base, I would know that it is a state of metabolic acidosis. So first I can go through in here and rule out anything that has a normal pH or that has a high pH. So I can already knock out A and B because B has a normal pH and A has a high pH. That's an alkalosis and a normal ABG. A and B can't be correct. So then I'm going to look at C and D. And then I need to figure out one of them, it looks like is going to be a metabolic problem. And one of them is going to be a respiratory problem. And so I really have to figure out which one is going to be the metabolic issue. So what I'm going to do, and I'm not going to, if you want to learn more, I have tons of videos on how to interpret ABGs, but I'm doing this all in my head. So I'm going to look, and so both these have a low pH. So I want to see which one, because if it's a metabolic acidosis, then my pH and my HCO3 should be going in the same direction, or they should both be low because they're a state of acidosis. So the only one where both the pH and the HCO3 are both low, and I don't want to say because I don't want to lie here to you. What do you call it? Well, both C and D, because I was gonna say, man, why did I screw myself over this way and make it harder? So both C and D both have a pH and HCO3 that's low. But let's look here. Let me do this real quick. So I'm gonna go through like the way that I normally do it. So normally I look at, okay, acidosis or alkalosis. So C and D are both a state of acidosis. Then I'm gonna compare my pH to my CO2. So my pH and my CO2 in C are going in the same direction. So they're both low. So that's a sign of a metabolic problem, because if they were going opposite, like in D, my pH is low and my CO2 is high, which is a state of respiratory, yeah, did I say that right? Yeah, respiratory acidosis. I just really messed this up here because really in reality, and I'm sorry that I stink so much at this, I swear that I'm just human. This would be more like this. So this should be more like that. All right, that makes me feel a lot better. So, and I promise I proofread these things, but maybe my brain was a little scattered when I did this one. So I apologize for any confusion, but let's just get back to this and act like Miss Woodruff is a more perfect human being. I am not perfect at all. I make lots of mistakes and I'm still learning too, guys. And hopefully you can be patient with me here. But anyway, let's get back to my strategy. So if I could use the original strategy I said is that like what I would look for is which one has a pH that is low, but an HCO3 that is low too. And so the only one that would now be correct for that is C. But let's say that I hadn't changed this back from what it was. At the end of the day, D is a respiratory problem because my pH and my CO2 are opposite, whereas C, my pH and my CO2 are the same. I'm going in the same direction, and my HCO3 and pH are in the same. So this is a metabolic issue. So in other words, C has to be the correct answer, no matter what. Even if I didn't change it, it's the only one that's correct because it's a metabolic acidosis. Doesn't matter if it's compensated or not at all. It just matters that it's a metabolic problem and an acidosis. And that's what's consistent with DKA. Hopefully that helped. That is a knowledge question there. All right, last but not least. Let's see if I can redeem myself. So a nurse is providing discharge education to a client with diabetes, which statement by the client indicates more education is needed related to managing chronic complications. So this is a, excuse me, discharge education again. But this one is a really key kind of question to learn. A lot of students will read this wrong. It says, which statement by the client indicates more education is needed? So we're not looking for what is right. We're looking for what is wrong. And saying specifically in relation to managing chronic complications. So I need to go through and see which one of these do I know to be true and which ones do I believe are false. So the first one is I will need to have my cholesterol and blood pressure checked regularly. Well, that's not an extreme, one of those extremes I told you about. It sounds pretty reasonable to have their cholesterol and blood pressure checked. And I know people with diabetes are at risk for cardiovascular disease. So I like that one. I think that's true. B is I should have regular eye exams and should report changes to my vision. Well, I know that diabetics can have that diabetic retinopathy where they have decreased vision. So to me, that sounds good too. I think they should have regular eye exams. C says I will need to have my urine checked yearly for presence of glucose. This one, the urine checked yearly sounds good, but I don't know about presence of glucose. I thought we were looking for albumin or protein in the urine. So I'm going to hold on to that one because this is some ways that those crazy nursing professors can be super tricky, and most of the answers correct except for one part. The last one is I will need to watch for signs of infection, including increased temperature. Well, that sounds reasonable too. And that sounds like something, that diabetics are at high risk for infection. So the only one I have questions here about is C, because I think like they can have glucose in their urine. They don't necessarily need yearly checks to see if there's glucose in there. But I do think that if that said protein, albumin, etc., that would be correct. But since it says glucose, I think that is the one that requires more education. And I'm right. So yes, so C is correctly incorrect that every year they're going to have their urine monitored for albumin or protein, which is a sign of kidney or like kidney problems or kidney failure. So that helps manage because diabetic nephropathy is no joke. Anyway, you survived another video with me with a few errors, but I purposefully do not try to go and redo these videos to show you that I'm an imperfect being and you can be imperfect too, and we can learn together. And hopefully these videos are helpful and get you one step closer to doing better on your exams and better understanding this content to help your patients in the future. See you guys next time.